Hi, thank you so much for participating in the Wellness Wave brought to you by ACP Southern California Region 3 chapter. My name is Alex Malouf. Hi, can you tell us a little bit about yourself and what you do?
Hey, hello. Hi, everyone. My name is Olu. I am currently a internal medicine resident here at UCLA. And that's currently what I do right now. I'm currently living in Long Beach and it's been great.
Awesome. And, can you tell us of how you chose medicine as your career path?
Yeah, so I guess you can kind of go back. Born in Nigeria, immigrated to the United States. Family had similar kind of immigrants kind of dreams as many, kind of pursue education. Early on in my life, I kind of had interest in science, which is like most. However, I grew up in Inglewood and Long Beach, which many would identify as kind of under-resourced communities. So I had to do a lot within myself to kind of expand my knowledge. I had to seek other things, seek summer programs, seek college campus or college classes to take, kind of help expand my knowledge and, build my curiosity in this, world of science. I soon went to undergrad at UC San Diego, and that was really where I was able to really challenge myself and really see that, medicine is something that I can do. A lot of it was at that time, a lot of men in my family, I found out had a lot of cardiovascular disease. And I think naturally, I was kind of curious on why and why does it affect particular groups and, what can I do to kind of help it out, in the smallest of ways. And I think really set the framework for me kind of, starting to apply to medical school, starting to take the MCAT, just that curiosity specific to cardiovascular disease, which kind of opened the door to like medical school, which is like so many different opportunities, so many different things you can learn about. So I would say just that curiosity of something personal with my family and kind of building on that and wanting to learn more and being exposed to more things. So.
Well, thanks for sharing. I think that it is really important that our viewers also be, as curious and interested in like learning more about medicine and to find their career path. But some of us are still trying to figure it out, both medical students and residents.
Yeah.
So do you have any words of advice for them as they're trying to figure out their career path?
Yeah, so I think, the biggest thing is very cliche, but, always be curious, always ask those questions. There's a vast amount of specialties in medicine, and you really want to figure out what is something that fits with you. And it's a hard question to really answer earlier on in your career. And I think ways to do that is just to, every patient encounter, every rotation, every course that you take in your first, 1.5 to 2 years in medical school, just ask yourself, do I enjoy this topic? Do I enjoy talking to patients? Do I like using my hands? Do I like thinking more? Do I like to do both? There's just so many things medicine can offer. And once you can answer some of those questions, that can really help kind of guide you down the right path of what's truly for you. And the second thing, which I think is honestly the biggest thing, is just asking questions to faculty, sitting down with attendings and just asking them, like, do you enjoy what you do? Because a lot of the attendings, some of them, they do research, some of them, they do clinical work, some of them, they do both. And you can really just challenge them and kind of figure out, like, what do like sincerely just ask them questions like, oh, are you happy, with your current job? Are you happy, working with medical students? And they can tell you like, yeah, I'm happy doing this, or no, I wish I did this instead, or how is it being on call, while having a family? Like, is that challenging? Just really ask them these questions. A lot of them are really open to answering. And I know I did a lot of them myself during my rotations in third year of medical school. And that really kind of helped me figure out which career I thought would be the best fit for me. And I think a lot of that is missed. People are kind of afraid to talk to faculty. And I think you should just ask them, because eventually you're going to be in their shoes doing the same thing with, family and kids, if that's your goal, or, traveling or whatever it may be. And you can kind of get an idea what you want your future to look like.
Those are brilliant points. And I think that our audience will definitely benefit from hearing it and the just tangible things that can be done. So shifting gears now to talk about wellness. I'm going to ask you a couple wellness questions. So the first one being, how do you manage to juggle in medical school and in residency, a full load, plus navigating wellness?
Yeah, so that is a real question, and it's a hard one to really actively do. Just being realistic, as a resident, especially as an intern, it can be challenging kind of finding time to take care of yourself and figuring time to really, do those things so you can be a better resident. But one thing that I could recommend is, I think first and foremost, there needs to be a passion for taking care of yourself, because not everyone has that passion. Some people do prioritize work, and that's just naturally who they are. But I think first and foremost, you have to have that passion to really care for your well-being and your health and your wellness. And once you have that, I feel like finding that time to do those things isn't that hard. In my intern year, yes, the schedule was busy. It was hard, but somehow, some way, I was still able to fit in time, to take care of myself, to go hang out with family and friends, to go visit friends, to work out, to exercise, all that things, even with that busy schedule. And I think a lot of that really came from it being a natural passion of mine. I really prioritize that. And I feel like once you can prioritize that, you're setting things well for yourself. So just really just initially having that good attitude, and then creating that schedule and making things work.
I like that what you said about having the passion for wellness and really incorporating that. Another question I have for you, Olu, and I know you for quite some time now, and I've seen you navigate some difficult situations and things like that. So I want to ask you, how do you remain strong when you're dealing with difficult patient situations or interactions?
Oh yeah, you're gonna run into that. You're gonna run into it as a medical student. You're gonna run into it as a resident. You're gonna run into it being, you and a patient by yourself, or you and a team of doctors and a patient, or family members and just you alone. So it's hard, but it's definitely doable, and you can approach it in a good way that you're still maintaining a good patient-physician relationship, and you're not compromising it whatsoever. And I think the best, recommendation I can give from my own experience is, before every patient encounter, check yourself. Before you walk into the patient room, if you're rounding and you're about to go inpatient and do bedside rounds or whatever, just check yourself and just, reset yourself and remember that, this is a patient, this disease, may be something that is new to them or something that is chronic. And you don't want to be, brainwashed with your thoughts, because you see diseases all the time. So it may not be a big deal to you, but just always reset your mind and remember that, okay, this is a patient. This is different for them. Let me come in with a good approach. Let me come in, kind of patient and curious at the same time. So you're not only teaching them, but you're also learning from the patient as well. And I feel like if you come in with that reset, that sets the stage well for your encounter with the patients. In instances where, you do that, but things still kind of fall through and the patient is angry and they lash at you, the best thing to do is just to listen to them. I felt like that has been the best approach for me. Just, listen, acknowledge their feelings. If they're frustrated, acknowledge it. There's no benefit in fueling the fire. There's no benefit, in making excuses like, oh, like this, that, and the other, because the patient may just continue to be, upset, and that can tarnish the relationship. But if you listen and you acknowledge their feelings, what they appreciate is the fact that you're hearing them out and you're not over speaking them. And I think once you do that, that builds that relationship, and that patient trusts you on a different level. And now they're able to share things with you, and they won't assume like, okay, this doctor is doing this and he doesn't really care for me. He's just telling me to take these things, but he doesn't know that I've taken those things before. He never been asked if I've taken those things before, and it never worked for me, So taking that time to listen, you learn new things, and then that's how you can kind of change the way you take care of the patient, and kind of, make sure that's applied to their care moving forward. So I think those are the first few things that come to mind, and, handling those situations. So just, listening and, resetting yourself before you even see the patient.
I think that's so important. And I'm glad that you shared with us the importance of like just patient-centered care and focusing on the patient as a person. And I just want to thank you on behalf of ACP for being interviewed by us today. So thank you.
Thank you all. This has been a great opportunity. I appreciate it. And I hope this video is helpful and people can learn and take a lot away from it.